From darkness to light, surgical management of Terson syndrome hemorrhage. This video delves into the presentation, diagnosis, and surgical management of Terson syndrome in a 35-year-old man following a traumatic brain injury. Our patient, a 35-year-old man, presented with vision loss in the right eye after experiencing a car accident and subsequent seizures, leading to hospitalization and right frontal temporal parietal craniectomy for subdural hemorrhage evacuation. He complained of right-sided vision loss. Examination revealed vitreous hemorrhage with subhyaloid hemorrhage and a shallow localized retinal detachment was seen on ultrasound B scan. Therefore, a diagnosis of Terson syndrome was made and the patient was planned for a 23-gauge pars plana vitrectomy with internal limiting membrane peeling. Standard 23-gauge ports were made and infusion started. A core vitrectomy followed by vitreous truncation was performed to remove the obstructing vitreous hemorrhage, allowing for a better visualization of the posterior segment. Layer by layer, the dense vitreous hemorrhage was cleared using a cutter, gradually restoring visibility within the eye. As the view became clearer, a posterior vitreous detachment was induced to facilitate further vitrectomy. A large amount of old subinternal limiting membrane hemorrhage was noted over the posterior pole and also superonasal to the optic disc. The internal limiting membrane was then stained with brilliant blue-green dye under air, and the tense internal limiting membrane was then peeled meticulously. Following the internal limiting membrane peeling, the old blood was carefully aspirated, revealing a healthy underlying optic disc and macula. An air fluid exchange was then performed to ensure proper tamponade and the surgical ports were closed. Post-operative follow-up revealed significant improvement with the patient achieving a best-corrected visual acuity of 6.6 for distance and N6 for near. Fundus examination revealed a clear vitreous cavity with a well-attached retina. OCT also showed a normal foveal contour. Terson syndrome, characterized by intraocular hemorrhage secondary to intracranial bleeding, often manifests as vitreous and subinternal limiting membrane hemorrhage. The presence of such hemorrhages can significantly impair visual function and necessitate prompt intervention to prevent further complications like retinal detachment or macular pathology. Timing and approach to intervention must be carefully considered, taking into account the patient's overall clinical condition and the risk of surgical complications. A close collaboration between ophthalmologists and neurologists is hence crucial to ensure comprehensive management of both ocular and systemic aspects of Terson syndrome. This case highlights the successful surgical management of ocular manifestations of Terson syndrome, emphasizing the role of vitrectomy with ileum peeling in restoring visual function and underscoring the importance of interdisciplinary collaboration between ophthalmologists and neurosurgeons.